Well, thank you for listening into this conversation that we're having today on sleep and perimenopause and menopause. And I'm really very happy to introduce you to Dr. Giselle Withers, who is a clinical psychologist with over 20 years' experience in treating a range of mental health and chronic health conditions, with a special interest in sleep psychology. So Giselle runs an Australian-wide private telehealth clinic, which is called Avoca Health. She has clinical rooms on the Gold Coast, and she's the founder of an online program called A Mindful Way, which is quite an innovative program in that it combines mindfulness-based interventions with cognitive behavioural therapy for insomnia, or CBTI. So this program has been validated in a clinical trial through Monash University and is currently undergoing a larger study. Giselle also trains and supervises other psychologists and PhD students in the area of mindfulness-based CBTI, and also runs group programs for women in the menopause transition to experience better sleep and more restful nights. And I'm pretty sure that we can all benefit from learning more about the importance of sleep and what we can do to optimize our sleep. But before we jump into the ins and outs of sleep, how did you personally become interested in perimenopause?
Yeah, so without going into my full journey, professional career, I can say that the perimenopause area really felt like a natural fit for me because my work as a clinical psychologist has always been deeply rooted in health psychology and the mind-body connection, or a better term for that is the biopsychosocial model of health. So when I started my undergraduate training, my professional training, I did a double major in psychophysiology as well as psychology. So this provided me with a very solid foundation in biopsychosocial health, and that equipped me to have that complex understanding of the complex interplay between biological changes, so what's happening in the brain and the body on a physiological level, with psychological changes, so what's happening with our beliefs and our thoughts and our personality traits, with social changes. So that's relationships with family, friends, our social network, but also in our broader community and our workplace and where we are in our life. So this really fits well with the way that we need to be understanding perimenopause and all the changes that women are going through. Yeah, and I've always had an interest in sleep psychology. So all the way through my training, I conducted research in sleep and sleep psychology, and worked at the Melbourne Sleep Disorder Centre and ran CBTI and mindfulness-based programs for people with insomnia. And then when I worked across different settings, so I've been working in the chronic pain management area, chronic fatigue syndrome service, I've worked in oncology. I brought that sleep knowledge into all of those areas because, as you know, all of those people also deal with sleep problems, and was able to use that within that work. And it's also a natural progression that working with people with perimenopause, also, as we know, about half of that population also has sleep problems. And like many other women, I think, who come to perimenopause later in their careers, it's often through a lived experience of perimenopause. So I found myself having sleep disturbance for the first time in my life. Uh, and even though I know all the tools and I'm a so-called sleep expert, found myself awake at 3 or 4 in the morning, wondering why I couldn't sleep, until I joined the dots and realized that actually these are the changes that are happening for me through perimenopause. So I started my own learning and investigation, and now have a much better understanding about all the changes that happen in life at this stage. A big part of that being hormonal changes, but there's a lot of other changes happening as well. And luckily enough, I didn't develop an insomnia disorder because I was able to use all the tools I had. But I also realized that there may be another sleep disorder happening for me. And I did have a sleep study done, had mild sleep apnea, and now that's treated as well. So it's really important for women to understand all the different things that might be happening with their sleep. And I'm really happy to be working in this area to help other people navigate this area, particularly in sleep with perimenopause.
Yeah, so sleep is so integral to health and wellness. So why don't you maybe outline why it's important, why we're used to, we've all heard these wonderful stories of these amazing politicians and clever people who got by in 4 hours sleep, and we'll think, oh, it's something you can do when you're dead and so forth. But we've really shifted our thinking about the importance of sleep.
Yes, it really is important. You could say it's our ultimate recovery tool. So it's not just a time that we're switching off at the end of the day. It's really a time when our bodies are doing the important repair work. So we're restoring and we're regenerating at that time. So without sleep, we are compromising every system in our body, from our immune defenses to our ability to think and learn and process information. So sleep is a biological need, just like our need for food, air, water, staying warm. It supports our immune system function, and recovery, protects us against chronic illness. Sleep also supports learning and memory. So brain research has found that new neural pathways are developed overnight that help us remember information that we've learnt during the day. And toxins are cleared from our brain and body overnight when we sleep. Damaged cells continue to repair and regenerate during sleep. And we use sleep for energy conservation, you could say, and as well as restoration. And of course, it's really good for our mental health as well. So our emotional functioning, and there's evidence that suggests that rapid eye movement sleep, or our REM sleep, is really important for us to process our emotions and emotional events during the day. So yeah, and anyone who hasn't been sleeping well knows the effect that it has on them. So rather than go into all the consequences of not sleeping, which can actually elevate people's anxiety, I think covering how important sleep is probably a good way for people to know that prioritizing their sleep and getting help is just so important, not to just leave it as something you need to live with.
Yeah, for sure.
So, yeah.
And a lot of, when it comes to, we'll talk about perimenopause in a little bit, but when it comes to the changes that occur on top of existing sleep patterns, a lot of women bring various sleep disorders into perimenopause. And clearly, for example, hormone treatments are not going to be incredibly helpful for those pre-existing behavior problems. So it is often, we would love something very simple like a patch to fix everything, and it just doesn't. If we could take ourselves back to that biopsychosocial model of wellness, there's always a bit of column A, a bit of column B, column C happening across all of our things. So
Yeah.
what is insomnia? Because many people describe themselves as being a chronic insomniac without really knowing what that is. It's got a clinical definition. They also describe, and I'm really interested in this because it comes back to our self-labeling and beliefs around sleep, is I'm a poor sleeper. It's like, oh,
Yes.
tell yourself you're a poor sleeper.
Yes.
We see a lot of people at Viv talking about the fact they've had pre-existing sleep problems.
Yeah, there are a few that obviously there's pre-existing problems and there's new sleep problems that do develop during perimenopause. So I'll talk about those, but it is useful for people to have an idea of what normal sleep looks like too. So I might just very quickly cover that. So because there can be a lot of unrealistic expectations about what sleep should be. And so knowing that that normal sleep for most people is around 7 to 8 hours, but some people do only need 6 hours, and some people do like or need more, like 9 hours. So as we get older, we also seem to need less sleep. So our sleep tends to be shorter when we're older and a little bit lighter. So it is normal in some regards with aging to have a shorter sleep, to have a lighter sleep, and also for the circadian phase to advance a little. So we tend to be more likely to be tired in the evening earlier and waking up earlier as well. So when we sleep in sleep cycles of around 90 minutes. And these are different stages of sleep that include a light sleep, then we move into deeper stages, and then we actually come back up through the lighter stages and have a period of REM sleep. And just one sleep cycle can be around 90 minutes. It varies between people, but it is very normal to wake up after a period of dreaming. And therefore, if you've had 4 or 5 sleep cycles in a night, again, very normal to wake up 3 or 4 times in a night. So some people, a lot of people have a misconception that they should kind of go under for 7 hours and be in a solid deep sleep and then come out at the end. And if they've noticed they've been awake, actually feel like that is disrupted or disturbed sleep. Um, so I think just correcting that misconception and letting people know it's very normal to go through periods of light sleep or to wake up, and that the second phase of the night is generally a much lighter sleep. So we don't tend to go down into our stage 4, what's 3, 4 deep restorative sleep in the second half of the night. So again, a lot of people feel when they're in the morning, they're kind of dozing in and out of sleep, that they're not getting enough deep sleep. That's actually a very normal pattern of sleep. So that can be really useful, I think, for people to know first. So in terms of what insomnia is the really the feeling that you're not getting adequate sleep. So you're taking too long to fall asleep. So you're getting distressed about taking too long to fall asleep at the start of the night, or you're waking up and having a period of time where you're awake in the middle of the night and can't fall back to sleep, or you wake up too early and again can't get back to sleep, or you have this overall feeling that sleep is unrefreshing and unrestorative, and then having daytime problems with that. So fatigue or sleepiness, or just the feelings that you're not concentrating, a bit of brain fog. So there needs to be some indication during the day that you haven't been sleeping well and that it's causing you some distress. So about half of women have sleep problems, and about 20 to 40% of these people have a chronic insomnia. The difference between acute and chronic insomnia: acute is when we just have poor sleep for a short time, so that could be a few weeks of not sleeping well. Chronic insomnia is when that has persisted for more than around 3 months, and you're having it 3 nights a week or more, and yeah, it's causing that level of distress for you, and really kind of getting caught in a cycle. Yeah, so that affects about 20 to 40% of people with perimenopause now, which is actually much higher. And the other sleep disorders, I was going to say much higher than premenopause. The other sleep disorders that people can come with pre-existing conditions, or they might develop during perimenopause. A very common one is what I described earlier as obstructive sleep apnea. It's a sleep disordered breathing problem. And that is, an apnea is when the upper airways become relaxed during sleep, and that might block or partially obstruct the upper airways, which means you're not getting adequate air, and that can last 10 seconds or less, or you can have periods of longer than that. And it's not a dangerous condition in the moment and then you're not breathing, and that could be a problem at night. What happens is our reflexes will kick in and we wake up to take that breath. So people can be waking up multiple times in the night when they're really meant to be in one of those sleep cycles, and it's that recurrent wakening that can cause the sleepiness during the day. So most people, like some of the signs of sleep apnea would be snorers, but then not everyone with apnea snores, so we can't use that as the only indicator. People will often wake up with a dry mouth, or they'll have headaches, which may be due to that reduced oxygen supply during the night. So yeah, not everyone has snoring. So some people say, I don't snore, so I can't have that. It is really important if you are having sleep problems. The research shows that in perimenopause, women with sleep problems, 50% of them are likely to be having a mild sleep apnea or more, as in it could be moderate. And it is really worth people speaking to their GP about that and having an overnight sleep study, because the treatments are fairly straightforward in that you can have a mandibular advancement splint, which I have, pop it in your mouth and it brings your jaw forward, which opens up the airways, or a CPAP machine, which is really positive airflow going into the airways overnight, which helps to open that up. And one of the reasons why the incidence of this increases during perimenopause is because of that change in estrogen. That means that we don't have the same muscle tone in around the throat area, and so that can soften somewhat as we notice softening happening elsewhere in our bodies, and that can really trigger the start of an apnea. Also, weight gain is common in perimenopause, and that increased weight gain can also increase the risk of OSA as well.
Hey, did you want to talk a little? So I just can hear our listeners rolling their eyes at I'm more sagging and drooping and softening.
I can do
Um,
it all.
yeah. Did you want to expand a little bit on any of the hormonal implications for sleep? Did you want to talk about any of those specific?
Yeah.
I'll just say
So
that.
yeah, I'll just I want to mention another sleep disorder that's worth
Yeah.
knowing about too, and that is restless legs syndrome.
Yeah.
So
This
again,
is
about
another one. I don't want you to tell me about it because I don't
I
want.
know people probably don't want to hear about it, but it
To.
is. But also, if you resonate with the symptoms, it might be an aha moment that,
Yeah.
oh, I'm constantly moving my legs. I don't know why I need to keep moving them. It's keeping me awake. What's going on here? It might be a restless leg syndrome. That could be due to low iron, so worth getting that checked as well. And periodic leg movements during sleep, which is a twitching that can happen. So you can kick your legs or twitch your arms. Again, with that one, people are often not aware that that's happening overnight, but it might be waking them up. A partner will often know, though, if you're twitching in your sleep. So again, the rates are like 30% in perimenopause. So again, it's not something to ignore if it's something we can treat and it means that you're sleeping better overnight. So yes, I don't want to bring more doom and gloom, but it's good to know that these things are treatable and worth having checked out if you're having
Yeah.
problems. Yeah.
And maybe we won't spend too much time talking about the treatments for apnea and restless legs because I think we'll be here all day.
I know it's a big topic.
Yeah. So from terms of the data from our women making appointments with us, obviously women are making appointments at Viv because they feel that they have hormonal symptoms, and I want to know what the implications of that is for them and whether hormone treatments might be effective or whether they might be required for health or so forth. But in our data, in the perimenopausal group, around 70% described feeling much better after starting menopause hormone therapy when it comes to sleep disturbance. And in the menopausal group, about the same, 72%. Whereas in our late reproductive, if your period is still regular, that's much lower, only about 40%, because obviously it's much more difficult to treat that group of women with hormone treatments because they have a different set of hormonal issues.
Yeah.
Shall we jump into CBT and mindfulness? Shall we?
Yeah, I mean, you might want to add something on the hormonal side
Oh,
here. Just I guess I wanted to say about the hormones. As you know, and you probably speak better to this than I would, that there's such a complex interplay of hormones in the body. So where we might think of progesterone and estrogen as reproductive hormones, what we know is that they have roles all throughout our body and they do influence our sleep processes. So they do interfere with the circadian rhythm function. They interact with melatonin and cortisol and adrenaline and adenosine. So they're all involved in the sleep-wake cycle. And it interferes with temperature regulation, our body temperature regulation. So again, if our body temperature is not dropping in the same way that it should by about 4 in the morning, usually that's when our body temperature should be lowest. It's usually about highest at around in the evening, 6 p.m. Of course, depending on where you live, that changes. But if it's not dropping enough, you can find that that's why we're sort of overheating around that time, and that can really interfere with sleep too. So yeah, that's why the hormonal therapy can be really useful for a lot of people to help get all of those systems back, well regulated.
yeah,
But may not help everybody because of some of the other factors at play as well.
yeah,
So yeah, hot flushes can be a big part of what is waking people at nighttime, and that's a big factor for perimenopause. Night sweats. So as you know, a lot of women, 70% of women will have hot flushes and night sweats, and that is linked to awakenings at nighttime. So this polysomnography findings do show that even just preceding a hot flush, there'll be a sympathetic nervous system elevation. and that starts waking someone up, and then they'll have a hot flash experience, and that can keep people awake, but also can be distressing. So some people find that really frustrating, that the hot flash has woken them again, and that emotional reaction to the hot flash can also be another maintaining factor for insomnia, which will take us into the conversation about CBTI and how it's not just about behavioral and physiological changes, but also about the emotional changes that we can make depending on how we're responding or reacting to what is happening in the middle of the night.
Yeah.
So,
Before we jump into that, we'll just
yeah,
round up those hormones discussions, because
yes,
we often, the simplistic, I think what you mentioned around, you had your own lived experience of perimenopause, which opened your eyes to a whole area of work that, as healthcare professionals, we tend to not get taught about. And our patients are and women in general are the people who pay the price for our lack of knowledge. But we used to think that it was the hot flushes that disrupted sleep, but it's much more than that. So you can have sleep disturbance in the absence of hot flushes. As you've identified, there's often wakefulness before the experience of hot flush, and that might be separated by many seconds. So it's not that you actually have the flush wakes you up. And these are all the brain-mediated changes of initially in perimenopause, when you're still getting a period and it's coming reasonably regular. Well, I won't say regular, it's irregular, but it's coming. You have erratic hormones, you're having change in hormone levels and elevated brain FSH. And it's those change in hormones and elevated brain FSH that are implicated in the symptoms, not just low estrogen and progesterone. So it's a lot more complicated than what we possibly think. And it's very simplistic to say it's just low hormones, give me the hormones and I'll be fine, because it's changing hormones, it's fluctuates brain hormones, it's all sorts of things happening there.
Yeah. And I think it's also just really important to say here, because again, all of this feeds into what we're doing in CBTI, is understanding the causes of the sleep problems. So mood changes, increases in depression and anxiety, which is really common in perimenopause due to a number of factors, is very much linked to sleep disturbance. So about 90% of people with depression will have a sleep disturbance as well, and it's highly linked to anxiety. So again, that's not about hormonal changes. It can be linked. So we know that increased hot flushes are also linked to higher rates. So like severity of hot flushes can be linked to higher rates of mood changes as well. So yeah, the mood changes is one. Also, we can have a whole lot of other health issues that can start around this time, like chronic pain conditions and aches, which can cause sleep problems as well. And there's a number of psychosocial stresses. So this is the time in life when we're probably under the highest amount of pressure, with most likely dependent children. You might have aging adults, adult parents. You might be at a higher level of responsibility in your workplace, changes happening with friendships, potentially in relationship stresses. We know that there's low libido and sexual dysfunction that can happen, which can affect relationships. So there's a lot going on for a woman at this stage in life, and that increased stress can be, again, on its own, a major cause of sleep disturbance as well.
I'll just share a fun fact with you.
Something fun after all of that depressing summary.
No, this is all just awareness, and we can change
It
many of
is.
these things, and just appreciating that they exist and they make a difference and they matter is helpful.
And normalizes that everyone is going through a similar stage in life, and it's pretty tough at times.
Yeah, it is tough, but it won't last. It won't last forever. So we often think of the menopause or whatever, perimenopause as being low estrogens, or estrogen's the master commandment. But a lot of the anxiety and the mood disorders are related not just to progesterone, which we used to think, but actually to elevated estrogen. So we get big spurts of high estrogen. And I don't, but when someone does a study looking at a really interesting study done, given men estrogen as a bolus, so given them big boluses of estrogen, the consequences of men who've gone from stable estrogen to big bolus of estrogen, really extreme anxiousness So it's like it's not just the hormone, it's the change in hormones and the height of hormones. So
Yes.
estrogen's often thought of the savior, but it can be a bit of a troublemaker as well. So
Yeah, anything out of balance is the
yeah,
problem,
I know.
isn't it?
And if perimenopause is something, it's a stage where we're out of balance.
Yes. Yeah.
So let's get to the nuts and bolts of the CBTI. Tell us all about it.
Yeah, so
And,
CBT.
tell us about the way we can get, tripped up with the way we think and believe about our sleep and how we can be our own worst enemies and what we can, yeah.
Yes, yeah. Yeah, because that actually talking about CBTI directly is pretty dry. But I mean it is useful to know though, because a lot of people think it's just sleep hygiene, which
Yeah.
is, oh, I just need to cut out my coffee and my alcohol and just need to go to bed at the same time every day, and that's all there is. Whereas CBTI is there's actually 5 key components to it. So sleep hygiene is one, and it is important. These are very useful strategies to know. All those things do interfere with sleep. So we do need to cut out our alcohol and drop down coffee intake and go to bed roughly at the same time each day. So that's all important. But we also need to know how to relax our bodies. So relaxation training is really useful if a lot of women are hyper aroused, which means we've got too much stress hormones. Oh, sorry, the cortisol's higher, we've got stress in the body, and the hyper arousal can be interfering with our sleep. So learning physiologically how to relax with deep breathing exercises or progressive muscle relaxation, or using visualization exercises to learn how to relax the body can be really useful in a wind down routine, but also throughout the day to help us manage stress. So that's one component. Another one is it's called stimulus control, terrible name, but really that's about keeping the bedroom a place where we associate the bed with resting, relaxing. Sexual activity, of course, is fine, but it's a place where we sleep. So we don't want to be in bed with the computer, finishing off work and doing emails and sorting out all the life admin in bed. That all needs to be happening in another room. So that's part of it. Also, if someone is awake in the middle of the night and they're thinking about life and trying to make decisions and doing lots of problem solving, or they're frustrated and anxious, we want to keep that level of stimulation outside of the bedroom too. And that's why we encourage people to get up in the middle of the night if they're in that distressed state and move to the lounge room to wind down and relax and wait till they start to feel sleepy again, and then return back to bed. If you wake up in the middle of the night and you're fine, like you're just resting and you're quite relaxed, that is fine to stay in bed, because you are resting in bed and we want the bed just to be a place where you feel quite relaxed and rested. So it's really only if you're distressed that you get up. So that's stimulus control. The fourth one is, not in any particular order, is bedtime restriction. And that sounds awful again as a term. So we like to use the word sleep consolidation. What that's about is trying to improve our sleep efficiency, which means that the time that we're sleeping is much more closely matched to the time we're actually in bed. So if you are in bed for 8 hours, but you're only sleeping for 4 hours, your sleep efficiency is about 50%, because you're only sleeping half the time that you're in bed. So that's not a good association when you're in bed, that you're awake for half of that time. So what we might start to do is reduce the time in bed, which increases our sleep drive. We do carry some sleep debt when you have less time in bed, but this is just for a very short, structured intervention to really maximize that time that you're in bed, that you are sleeping. And then people really start to feel like their sleep quality is improving. They don't have the big wakes in the middle of the night of hours awake in bed. They tend to sleep through. And that's a very positive experience for people. And then we open the window up slowly over time, so that sleep efficiency is maintained, and we want to get it up to about 85% and above. So again, it's a very difficult one to implement on your own. I think it's really important to do that with a health professional, or at least follow some really clear guidelines if you're doing it as part of a program, and understand the reasoning for that. And it is a very effective intervention. It's probably one of the most effective ones of CBTI. So the last one of the five is cognitive restructuring. And this is when we do look at all of those unhelpful thoughts that maintain insomnia. So for example, a really common one is you might wake up in the middle of the night and think, I have to get to sleep. If I don't sleep now, tomorrow is going to be awful. I'm going to have a dreadful day. That thought, it's not wrong, it's just not helpful. So if we think about that, it's going to increase our anxiety and our frustration. And now we have more sympathetic nervous system activation, which will keep us awake. So again, it's not that it's wrong, it's just what would be a different thought that I could have now that would help me get through this moment. And that might be something like, I'm working on this, I'm working with a psychologist, or I'm doing some work. It will take time. I tend to get through the day. I will manage the next day as best I can. So again, it's not a silver bullet. It just changes the level of anxiety to something that feels much more able to manage. I find self-compassion is also such an important tool to use that, yes, this is hard for me right now. This is really tough. I'm doing the best I can and things will change. I'll learn skills, things will get better. So it's just acknowledging that it is tough being awake in the middle of the night, but change takes time, not expecting an instant solution on the first night. So yeah, those are the components. Now, in terms of mindfulness training, I find that complements CBTI beautifully, because what we're really learning in mindfulness is a whole change in our relationship to sleep. So when we haven't been sleeping, it's really normal to put in a lot of effort to try to get to sleep. And this is where people use tracking devices to monitor sleep, and they really work at perfecting their sleep. And that can be very counterproductive because it increases anxiety. People can start to implement really rigid wind down routines, that you have to do things in a particular order and that it has to be a set formula. And it might work for a few nights because you've got confidence that, oh, it's worked. And then the moment it doesn't work anymore, the anxiety just goes straight up again. So with mindfulness, we are learning to accept that some nights we're not going to sleep as well as other nights. That's quite normal. That right now I'm safe. I can rest. I can relax my body overnight. Resting and relaxing my body is restorative. So if you've had a night of rest, we actually function pretty well the next day. It's usually the night that we're distressed and frustrated and anxious that we're exhausted the next day. So when we can use mindfulness to be accepting and just be in the moment, not thinking about the future, not ruminating over the past or worrying about things that have happened, stay present and be non-judgmental about what's happening and trust in our body's natural sleep processes, what we find is the body starts to relax, and then our natural sleep processes can work and sleep will come naturally without us really needing to do much about it.
So it's the whole, oh, I just need to relax. I just need to relax so I can get to sleep, and figuring out how you actually do that. So yes.
That anxiety is half of the problem, is that
Yes.
what do I have to do to get back to
Gotta get
sleep?
to sleep now. I've got half an hour.
So mindfulness is really a shift in gears. It's okay. You're here in the moment, you're breathing, you're accepting things as they are. The whole body just, softens and can relax. And that can really, paradoxically, be the thing that gets you back to sleep. Even though you're accepting being awake, it's actually the fastest path to go back to sleep.
Yes, yes, it
And
is.
trying hard.
Yeah. And of course, mindfulness skills are pervasive beyond just our ability to sleep. And so that ability to be aware of those thoughts that are unhelpful and let them just float by, and perhaps replace them with a different thought or focus on a different perspective, is helpful in many contexts.
It really is.
Yeah, it is helpful. I find that for me, one of the simple little behaviors that I can do, it probably fits in with the sleep hygiene aspect, is to just make sure I can't see a clock during the
Yes.
night, because if I can see the clock, then I'm aware of the time, and I look at the clock again and I'm aware that it's half an hour later and I'm still awake.
That's right, exactly. And so we definitely encourage not looking at the clock. And just now is now. That's the perfect mindfulness answer, isn't it? And right now is right now, and just trusting it's okay just to lie here, and I'll know when it's awake because it's light, and or the alarm will go off if you need to get up when it's dark. That's all you need to worry about. Yeah, so if you're using sleep diaries because you are doing some sleep management work, I recommend just using a very simple pen and paper diary, just completing that in the morning and just estimating the time that you think you might have been awake, not worrying too much exactly what time it was, and not even worrying too much about exactly how long you're awake. Often we know whether it was half an hour or it was about an hour, or if it was 2 to 3 hours. We do tend to know the difference between those. And that's, we don't need precise information to do the CBTI intervention.
Yeah, yeah. So, are there any, what should women do if they are looking to improve their sleep quality, or they believe that they've got a problem with insomnia or some sleep problem when it comes to, and they check with their doctor and they don't have sleep apnea?
Yeah,
Um,
yeah.
what should they, what are their next steps?
So there are some really good tools and information around in terms of just good tips that you can use. I have an ebook for women with going through perimenopause with sleep problems that they can download. It's a free ebook on my website, and that just has some really good, clear tips that people can do. Um, some of the things that they may be quite practical. Maybe people have already tried some of these things, but getting a regular routine is useful. So noticing what time you feel sleepy at night time, and not go to bed when you just think you should be going to bed. So just monitor your sleepiness for a few nights and work out, when are you yawning? When do your eyes feel tired? When are you sort of starting to nod? That sign of sleepiness gives you an indication of your circadian rhythm and when you're most likely to be sleepy. So if that is happening earlier, like at 8 o'clock, or 8:30, and that feels strange to you, I would encourage people just to experiment with what happens if you do go to bed when you're sleepy at that time, rather than push through and binge watch, your favorite TV show. And maybe you are waking at 4 a.m., but that's actually a much more natural sleep for you. With people with perimenopause often wake at 4, but if you are going to sleep around 8, then you are getting 8 hours sleep, and that could be a really good quality sleep if you're much more aligned with your circadian rhythm. And people who've tried that, and it might seem extreme for some people.
I think it sounds good. I think all the washing up and everything gets left to someone else if I'm in bed
That's
at
right. There's
8 o'clock.
so many advantages.
Yeah.
Yeah. And then when you make a decision to be up at 4 rather than feeling distressed about being awake at 4, suddenly the morning is a beautiful time too, because no one else is awake in the house and you have that time for yourself. Or you can go for a walk. Or you might think, oh, finally I can get to the gym. I've never had time before, because in the evenings we're all so tired. But actually, at 5, there's often classes on, and you're home at 6:30 and have done that exercise as well. So that can be a game changer, if that works for your circadian rhythm. So that's just another tip in terms of looking for when you're sleepy.
So that's really interesting, because when we talk about, so some of the information seems conflicting. So go to bed at a regular time, wake it up at a regular time. But what we're actually trying to do is go to bed at your regular time.
That's correct, exactly. That's the problem with generalist information on the web, is you can't really bring out the nuance in terms
Oh,
of,
that's so true. Um,
yes.
is there anything else you'd like to talk about just before we wind up and talk about your new program?
I mean, there are lots of things, but I'd be very happy to meet with you another time, and we can talk more about mindfulness and sleep and how useful that is. There are simple ways people can start mindfulness practices. Again, I have it's called a compassionate body scan for perimenopause to help with sleep. So that's on the website as well, amindfulway.com.au. Even if you just start with a daily meditation practice, 15 to 20 minutes, that that there's a lot that you're actually learning in meditation that can be useful during the day and at night time. So I guess that's giving somebody, people, a place to start in terms of
Yeah.
exploring mindfulness
Yeah.
with that.
And we often link mindfulness with meditation and success and achievement. And I think that we can get hung up on the definitions of these things, but ultimately being present in this moment and
Mm,
understanding that much of our distress comes as a result of our thoughts, which are just thoughts, um,
yes.
can be quite life-changing. And there are moments of mindfulness without even having your 15, 20 minutes of meditation practice that you can find in day-to-day life. So just being aware of sensations on the skin when you're out in the sun, aware of the noises. Those mindfulness skills allow you to engage much more in your environment and understand your
Yeah.
internal emotional state as well.
Yes.
It really can help you, cut off at the past when you're winding up into stressful, angry moments or whatever. So it is an incredible life skill that I do in my sport and exercise medicine practice. I use mindfulness a lot when it comes to chronic pain.
Yes.
Because pain is it's a sensation. It's not always a helpful sensation. Sometimes it is. It's usually an unwanted sensation, but it is just a sensation.
Yes.
And so mindfulness can help us in that perspective as well. So, and simple
Yes.
breath work to allow that as an easy way into mindfulness if you feel that meditation is a little bit challenging for you.
Yeah, absolutely. That's
It's
right.
very hard to find that 15 minutes. Oh, I'll do that in 10 minutes. I'll do that after work. I'll do that. Like I keep putting off that 15 minutes.
Yeah.
So
That's right. Yeah, and in the I mean, yeah, absolutely right. And in the online program that I offer on the mindfulness-based CBTI, it follows if people know about the mindfulness-based stress reduction program, so MBSR, they teach a range of different mindfulness practices. So you're right, it's not just about sitting down, following your breath, but there's mindfulness of walking. So I teach that as well, and people can then use that when they're at the beach, just really bring awareness to all of their senses while they're walking. There's mindfulness of movement. So that's not there's the stretching yoga you might see in a yoga class, but gentle stretches that really is about body awareness as you're moving and really, yeah, just noticing all sensations as you move. So it's a very gentle yoga mindfulness of movement practice I teach as well. Also mindfulness of thoughts, where you can spend the time actually just noticing what you're thinking, and you might put a topic on that, a category, like that's problem solving, or that's daydreaming, or that's planning. So we start to practice observing thoughts and not just get carried away with them. And then there's a compassion practice as well, the rain, a compassion practice. So yeah, there's lots of different ways you can practice mindfulness. I should mention a 3-minute breathing space, which is just 3 minutes of being aware of where you are in the moment, your environment, sounds, how the body's feeling, and then just narrowing it into the breath and then refocusing back out again. It's like an hourglass. So it's just a tool that you can use once you've learned it in any moment, anytime. At mindful eating. And I also teach mindful eating, the Sultana exercise, if you've come across that. It's just using anything that you might eat to really just bring all of your awareness to that action. Most of the time, we're not really present, are we, when we're having our meals? We're thinking about something else. So it just reminds us to, again, as you said, any moment in time, we can take that as a moment to be really aware and notice what we're experiencing while
Yeah,
we're experiencing it.
yeah.
Mm.
Sounding a little philosophical at this point, but let's just round up. So the perimenopause and the menopause has important implications on sleep, amongst other things. The sleep impacts mood, health, all sorts of other things. And the three main things that might be impacting women would be some insomnia, which is more behavioral and historical, learned, so to speak. It might be restless legs. It might be sleep apnea. So we want to define what's actually going on in sleep. Hormone therapy helps many women because, especially if it's a new, especially if it's associated with hot flushes and it's a new behavior rather than an old behavior. and looking at multi-dimensions. So looking at mindfulness strategies to pay attention to cognitive restructuring, to allow you to cognitive restructure, to look at the time spent in bed and sleep consolidation. This is like a test. What are
You're doing well.
sleep hygiene, and there was some other couple of things.
Relaxation training
Relaxation.
and the stimulation control, which is
Yes.
really just protecting that space in bed for a place
Yeah.
to rest. Yeah,
Yeah. So thank you for telling us all about sleep.
very welcome.
Where can people find you, and tell us about what you're planning for the future tell us about your group sessions for women in perimenopause and menopause.
Yeah. So people can find me. I've got two websites. So one is called amindfulway.com.au, and that is predominantly all sleep information. So I have an online program called A Mindful Way to Healthy Sleep. People can purchase that program anytime, and that teaches it's really video lessons of me teaching CBTI and mindfulness with exercises and downloadable audio recordings and a workbook. So very comprehensive program that people can use. And through that website, I'll also be running these perimenopause groups. This is to support women going through a CBTI mindfulness program. So I would have an individual session with each person who would like to join the group to do a full assessment and understand their sleep needs, and that will allow me to tailor the program to their needs. They could also then they will undertake their online training, so they're getting all of the information and start implementing it throughout the week. And then in the weekly sessions, we'll talk through I'll sort of revisit the content to make sure everyone's understanding each component, the opportunity to ask questions, offer support to the women as they're implementing those programs, some shared experiences so people have support in terms of what it's like going through insomnia. And then I have a follow-up appointment with everybody at the end of the group too, to work out what their ongoing sleep needs might be, or whether they've had success in sleeping well, or they might need some individual work. So with my individual private practice, that's through my other website, Evoca Health. And I see people with a range of different issues there. So whether it's sleep or anxiety or chronic pain or chronic fatigue. So I would then see people on a one-to-one level if needed for therapy through that practice. Yeah, so
That's more your psychology
that's my
standard
psychology practice.
familiar with. So I think with the group sessions, I think you're going to run some face-to-face and via telehealth.
Correct. Yeah, I'll start the first one via telehealth, and that's beginning in February, so February the 21st on a Friday. That's a lunchtime session, so it'll be 12 o'clock to 1, and that'll be, because it's online, anyone can access that from anywhere in Australia. And then I'll be running in-person groups in the Gold Coast, so that date hasn't been set yet. There's a wait list open for that, so if people would like to put their name down, I'll let them know as soon as that's open. I'll only be taking about 15 women in a group at one time to make sure that everyone's getting personalised care. So if they're not in the first group, they can keep their name on the wait list for the next one.
Perfect. And these groups, they're actually gathering together, aren't they? It's not, they're gathering together as a group.
So the online one will all be online at the same time.
Yeah.
And in person, it'll be meeting together in a room, correct?
Yeah, because when we were preparing for this chat, we also talked about the value in what's becoming increasingly known as shared medical appointments, where people's lived experience and peer support actually ends up with better outcomes than just simply a one-on-one. Although obviously some people need one-on-one, there's multiple reasons why you might do that. So there is incredible value in being in a small group like that.
There really is. And look, I think insomnia itself can be very isolating. So people awake at 2 or 3 in the morning and awake for a few hours at nighttime. It's a really lonely experience for many people. And when you're going through a group program, because I've run many groups in the past, it's just the sense that I know that there are other women, I know who they are, and we're probably all awake at the same time. I'm not encouraging people to get in contact at 3 in the morning, but just knowing that we're all working on this together is a very supportive experience for people. So absolutely, that shared experience is so valuable.
Yeah, so there's a WhatsApp band between 8 p.m. and 8 a.m.
That's right.
Yeah, okay. Well, thanks very much for your time, Giselle. We learnt a lot, and our listeners, I'm sure, will have learnt a lot, and hopefully they can apply some things to their own better sleep during midlife. Thank
Yes,
you.
very, very welcome. It's been a pleasure talking with you.